Well, I'd like to welcome you to the Kokua Council press conference. My name is Larry Geller. I'm a past president. We have board members present. We also have Lieutenant Governor Josh Green, John McDermott, the long-term care ombudsman, Kaeli Lopez from AARP, and Rona Fukumoto from Lanakila Pacific. What we're going to do this morning is I'm just going to go through Kokua Council's concerns initially, and then we'll ask for, we'll give the agencies and the ombudsman an opportunity to make quick questions or remarks or concerns. And then I'll give the microphone to Lieutenant Governor Green. I want to make it clear, though, that we thank Lieutenant Governor Green for being present today and to hear our concerns and comment if he wishes. But today, we're not pressing for answers. We're not looking for solutions today. This is step number one. So, Kokua Council is very concerned that the state be prepared to assure the safety of its senior citizens when the COVID-19 virus arrives. It's going to be here, there's no question. The question is only when. So there's time to prepare, and we would like that time to be well spent. We're presenting our concerns, not expecting answers, but to raise awareness and ask that the state explicitly lay out its plans for protecting our Kupuna in the very near future. There's not much time to waste. Let me start with concerns for the safety of residents in care homes. Hawaii has all kinds of care homes, but I'm sure everybody has heard about the situation in Seattle. We don't want that replicated at any facility in Hawaii. Hawaii has various levels of care homes. There's the nursing home, and then there's long-term adult residential care homes, assisted living facilities, all the way down to smaller facilities with perhaps 1 or 2 beds, foster care facilities, and even adult daycare centers. These operators need to be better informed than the operator of that care home in Seattle. We need them to know what to do to prevent infection, and we need what to do if the infection is present in their facility. And the reason is that seniors are the most vulnerable population. I attached to the press release a diagram showing the age divisions and the various death rates. We'll get into that in a little bit. But that nursing home, just to underline the importance of getting information and making sure that the operators are on top of it. 13 residents of that nursing home died of the virus in Seattle. At least six others have the virus. There's not enough test kits available to diagnose all 63 other residents. The availability of an adequate number of test kits in Hawaii is certainly one of the concerns we hope to see addressed. Also, vendors cannot serve that facility. It's locked down. But those vendors have been to other facilities that they also serve. So there's the possibility of spreading the infection out of that nursing home. Actually, out of the 180 staff members, 70 have called in sick. So that'll just give you an idea of the, of the severity that we really want to not see in Hawaii. Now, seniors in care homes are of heightened risk because of the age and underlying health conditions. They're in a nursing home for a reason. And that same reason makes them vulnerable to the virus, severe reactions, long hospitalizations, and the fear of death. We'll need to take proactive precautions in Hawaii to avoid that situation. Let me jump for a moment to concerns that we share with people of all ages related to the facilities. Are there enough isolation beds in hospitals in Hawaii? Are there ventilators of the correct type in sufficient number? I understand that there are some in stockpiles in some states. Well, how do you get them out and installed at the hospitals? Do we have enough ER capacity? Will medical professionals have access to test kits, proper masks, protective clothing. And I think a concern that has come up in the news recently, who will pay for testing and mandatory hospitalization? Let's say you're ordered into the hospital. Do you really want to see a $3,700 bill when you're checking out? That's happened, according to Twitter, anyway. But our Kupuna have needs that are not shared by the general population. Age itself is a risk factor. You may see in the news that we shouldn't worry because the death rate is only 2%. Well, and most people will recover. Yes, this is true. But if we're looking at Kupuna, older adults, let's see, 70 to 79 years old, the death rate is reported to be 8%. For 80 years old and older, the death rate is 14.8%. And within those age groups, people with impaired immune systems have a very high rate. The best data comes from China, which is a special situation. I don't think it could be relied on, but it's more than a third of people with immune deficiencies may be at risk of death, according to that data anyway. Now, in Hawaii, we also have, aside from the care homes and the nursing homes, we have hundreds of homebound seniors who are dependent on Meals on Wheels, medications, access to equipment, or to key services such as dialysis, or who are being served by caregivers, family members, volunteers, agencies. They are not able to follow the guidelines suggested by our emergency management agencies, which say, go stock up on food for 2 weeks, be prepared to stay at home. These people may not even see the guidelines if they don't have a computer. We're actually counting on the TV news and radio news to inform these people, because they do watch TV and listen to the radio. But they'll need better information than go out and buy toilet paper. You can't live 2 weeks on toilet paper. Also, many of them are not feeding themselves. We have people with special situations. We have people who require their caregivers every day even. A small number, well, I don't know if it's a small number, but a number of people have feeding tubes and need manual assistance to eat. So that person who assists them must be able to get to them. And at the same time, it's not just a question of getting to them, but it's a question of getting to them without bringing the virus along with you. Others have mobility limitations, walkers or scooters or wheelchairs. They cannot even do normal shopping. And they're going to need, I mean, these are people that are so far not covered by the general instructions to people to stock up. In the event of quarantine, the order will be given suddenly, and there's no time to prepare. Some Kupuna are oxygen dependent. They require refills of the cylinders, for example. Others require skilled caregivers, the feeding tubes, and some require to get to dialysis every couple days. When the quarantine order is given, there may be people who need to get to dialysis within 24 hours. So there's also a question of identification. Oh, will the handy vans even be running? We don't know the answers to these questions yet. We don't even know the questions yet. There's a question of how the people will be identified. Do we need to create a registry? Is it needed? How will we locate people with medical dependencies? How will we know the extent of the problem? How will we know how to get help to them? Seniors need food and water, not toilet paper, and they must be able to fight. They can't fight crowds at Costco. I lined up for toilet paper, but I didn't see anyone else my age there. Maybe they still have time. A quarantine is similar to shelter in place after a natural disaster, except that support agencies may be overwhelmed or unable to deliver services under restrictive orders. The needs of those who cannot prepare must still be accounted for and accommodated. We're not throwing these people off a cliff, at least I hope we don't want to. Even simple things like visiting the ATM or paying bills, paying your rent, may become challenges in the event of quarantine orders. We don't want people evicted because they can't get out to get their rent money out of the ATM. So in summary, It's necessary for planners to know what our Kupuna will need. They need to know how to get this information to them, to their caregivers, to the agencies, to the care home operators. We can't just assume that people are watching Twitter or even watching the news and depending on that. We need to know that we're communicating with the operators of the facilities and with every agency and caregiver, and the word is getting out. And before the word gets out, we have to create the word. We need good policies that are going to protect the people of Hawaii. So we have, I'm wrapping up at this point myself. We have present with us today agencies. We have AARP and Lanakila Pacific. What I'd like to do is just give them the microphone for a moment and ask them if they could briefly state a concern or even ask a question that may not be answered today, but questions are important. And then we'll, next John McDermott, the long-term care ombudsman, will give him a chance to say something, and then I'll turn the microphone over to Lieutenant Governor Green. Again, with no obligation to give us the answers, but we'd very much like to hear what he has to say, even at this point, or tell us about plans for the future. Kaylee.
Aloha, thank you, Larry. From AARP's perspective, as you know, we represent and work with and are interested in health care for seniors. One of the things that we urge is that the administration move quickly to release the funds that were approved on March 6th. There's a bipartisan approval for federal funds to the states, and we're looking forward to hopefully hearing from Lieutenant Governor Green that in fact the federal government is moving quickly to release those funds. As indicated, we are concerned about those who are also in health care facilities. As indicated, seniors are very vulnerable, as well as those with underlying diseases. So it's not just 50 plus, but those who potentially have underlying diseases such as heart disease, diabetes, other types of illnesses can be vulnerable to the COVID-19. With that, we also want to make sure that many of the organizations out there provide information, AARP Hawaii in particular, AARP for information for those who want to know more about what they can do to protect themselves and their loved ones. I would strongly recommend going to aarp.org/health. There's information there. Things that people need to be aware of is regrettably during times like these, sometimes there are scams. There are scams out there trying to look for investment for the cure or vaccines. Please remember to not give out information that you would normally not give to a stranger just because they're looking to provide perhaps the next best thing to protect or address this issue. So, addressing the issue of scams, they happen in many different ways, and regrettably people do use situations like this for that particular purpose. Again, I think please just inform yourself, keep yourself informed. There isn't a reason to panic yet that I'm aware of. We just take the precautions we have to take care of ourselves. Again, caregivers, you have to take care of yourself so that you can take care of those that you care for. And with that, Larry, I don't have much more to say other than it's great that an opportunity like this is being given to educate the public. Education and informing yourself is the best precaution you can take.
Yes, thank you so much, Kaylee. Next, Brenda Fukumoto from Lanakila Pacific.
Thank you, Larry. Lanakila Pacific, as a direct service provider, we are very concerned about being able to provide services to our seniors in the most safe way possible. Also with me is Lori Lau, the director of our Lanakila Meals on Wheels program. And I believe we sit here not only for our program, but for all the Meals on Wheels programs that are serving throughout the state. We are in a very difficult position. We want to be able to provide meals to our seniors, but we want to be able to do it without bringing, the virus to them or getting them sick. And we are looking for information on best practices, some guidance on how to provide the meals. not only for our staff, but for the hundreds of volunteers that support the Meals on Wheels program across the state. Mary, do you have any questions?
No, just to echo what Rona said, our primary concern is being able to continue the service to the seniors in the most responsible way possible, and to make sure that we have the correct information and the resources to be able to continue to do what we do. We want to be part of the solution and to help in any way that we can.
So I just want to add one more thing, Larry. I think this is a really important time for people to recognize that some of the concerns that we've, as a state and the country, has been wrestling with is the issue of prescription drugs. And the concern is the degree to which the pricing of drugs, even now with this particular situation, the shortage of testing kits, the issue of how do you come up with a vaccine, how do we ensure that the cost of prescriptions for issues like this, as well as everyday situations, aren't used as an opportunity to take advantage of people who are in need. So again, I would also encourage people to consistently look at the issue of the cost of prescription drugs, and this is just a good example of where that can definitely be a challenge for us.
Aloha. Okay, so I'm speaking for the Long-Term Care Ombudsman Program, and so we use volunteers and contracted staff to go into long-term care facilities and advocate for our seniors. And so we have almost 13,000 long-term care seniors or beds, and we want to make sure all those people are safe. And so right now there's no case of the virus in any of our long-term care facilities, which means that if it does happen, somebody brought it in. And so how do we prevent that from happening? So our facilities have lots of visitors. You have vendors, as Larry had talked about, family members, volunteers, church groups. And one example of what I noticed just recently, I was at a facility on Thursday, and they had a table set up, and they asked 3 questions. Have you been in any of these countries in the last 14 days? Do you know anybody that you've had contact with in the last 14 days? And do you have a fever or you're feeling okay? All of that self-reporting. That was on Thursday. I went back to that facility yesterday, and now they're taking your temperature. And so I thought, wow, okay, so what's happening in Washington with the long-term care facility is now registering here, that we really have to do a better job of monitoring who's coming into our facility. So I saw that as a great improvement. But you do have a staff who come in that late shift, 11 o'clock at night. Are they getting their temperature checked? Those off hours when you no longer have somebody at the desk monitoring who's coming in and out of the building, we need to make sure that everybody, including staff, are being checked for the virus and taking precautions. So I just wanted to bring up a couple of things that I've noticed over the years. So we see people in wheelchairs. If the wheelchair doesn't fit you because you're too small, you may not be able to reach over and grab that inner wheel. So you're grabbing the tire, which has been on the floor. So everything that's on that floor is now on your hands, and then you go to have your meal, and our staff vigilant about making sure everybody's hands are washed before they eat. These are things that I have noticed. If a feeding tube, some kind of a tube hits the floor, nursing staff knows right away they're supposed to clean that. But what about the call bell? Call bells are always hitting the floor. I've never seen anybody clean the call bell. We have isolation rooms where somebody has MRSA, somebody has something that's contagious, but you have residents with dementia who wander into those rooms and then wander in somebody else's room, and now they can be spreading something because you didn't put some kind of a barrier so that somebody with dementia would know can't go in there, or put some kind of a cone, the wet floor kind of a thing to create some type of an obstacle. I was at a facility where there was signage warning people that you have to gown up, and I saw families going in and out constantly, and I said to the nursing staff, why don't you stop them? And they said, well, that's family, how can we stop them? Well, the families are now going to catch something and maybe bring that home or bring that to their community or bring that to their school. And so, you know, if you put up signage, you have to enforce that signage. And so I think that sometimes, you know, staff are kind of reluctant to educate people about why what you're doing is potentially very dangerous and you need to follow the protocols that we've established. Some of our facilities, because they're short-staffed, they use agencies. I don't know what kind of training those agency staff have in terms of you know, preparing for this virus. And so everybody has to up their game, basically. This is very serious, and it's something that maybe we should have taken more seriously, because we always had the flu season. So anyway, the good side of this is that now everybody realizes that we all have a responsibility to make sure that folks in long-term care facilities are not hurt because of something that we foolishly did by not taking these necessary precautions.
Let me turn the microphone over to Lieutenant Governor Josh Green.
Aloha, everybody.
Aloha.
So I have a lot to share with you. You've heard excellent information already. Let me preface this with some general comments about coronavirus also and the flu, so that you have a very clear understanding of what we're dealing with. Keep in mind that every year globally, we have as many as 500 million cases of influenza. The flu is very lethal to our seniors also. Every year, of those 500 million cases of influenza, between 250,000 and 500,000 people worldwide can succumb to it and die. So for perspective, so far, we have 111,753 confirmed cases of COVID-19, obviously far fewer than the 500 million cases of flu that we will suffer, and we've had 3,888 deaths. So though the risk is very high at this moment that COVID-19 will spread and will continue to spread, it is infinitely smaller than influenza. I want to reassure people about that because, just as has been said a moment ago, we also have to worry with the same concerns and same preparations for influenza. Now, why do we worry more about COVID-19 than flu? Well, on a case-by-case basis, COVID-19 is more lethal. As Larry pointed out very well, the mortality rate can be as high as 14% for people who are over 80 years old and get COVID-19. Right now, only about 1 out of 1,000 people will die of the flu, as opposed to that rate, which is infinitely higher. So that's why it is much more severe. That's something very important to remember. In Hawaii, we have just 2 confirmed cases presently of the COVID-19 virus. One very senior gentleman who came from Washington State back to us, who's in the hospital, over 90 years old, and another person who was on a cruise ship. So just 2 confirmed cases. So that number will surely go up over time as people return from other places across our country, across the world, whether they've been in contact with cruise ships and so on. So please be aware. A couple important things right out of the gate, and then I'll go through a lot of information. Our hospitals are prepared. We have adequate intensive care unit spaces. We have 166 isolation beds across the state, and our healthcare providers are being very well equipped as we go through all of what we need supply-wise, statewide. In fact, this afternoon I will be with DMAT from 2 to 3 to look at all of their extra surplus supplies. That's our emergency stockpile. We also work with the hospital associations very thoroughly to make sure any of our hospitals or long-term care facilities can as quickly as possible get the protective gear that's necessary to keep people safe. This is the big picture. Now, in a more day-to-day picture for us, why do we worry? Well, we worry about contaminating potentially our long-term care facilities where we have our seniors or people who might be less senior but might have early onset dementia, and they themselves will have the same risk of dying at that higher rate. So the things that the CDC has recommended, let me just go bullet by bullet point. Post signs at all of our entryways to not go see your loved ones if you're sick. If you're sick, you should call them on the telephone, or we can set up FaceTime, those kind of things. People will understand. We know routines are important to our seniors, but still more importantly, we don't get people who are sick in touch with them. We ensure that sick leave policies are in place so that any of our employees who are sick are able to stay home. And we're working right now to make sure people who economically need those jobs will get workers' comp, will get unemployment benefits and so on in case they have to be away from work, because we don't want to set up other problems. We will assist all residents when they have symptoms, and we will assess them nonstop for the main symptoms, which are fever, cough, and shortness of breath. Those are the most likely symptoms of COVID-19. As we keep everyone informed, which we will say over and over again, continue to do the smart stuff. Get your flu shot, wash your hands, doing fist bumps right now. We don't want to have close contacts of our face. You stay 3 to 6 feet away from somebody. If they sneeze, the droplets will not get on you. You're much less at risk to get sick. We should restrict visits for people who are sick. That I want to re-emphasize. So if someone has fever or cough or shortness of breath, and they are a resident of our long-term care facilities, we want them to stay in their rooms so they don't spread it to other individuals around them, and we don't get an outbreak like we saw in Washington. In general, if people have undiagnosed respiratory issue, no respiratory problems at all, we just use the standard contact. We wash our hands, we make sure we don't cough or sneeze on one another. We again worry about droplets being the projectile from our sneezes and coughs. We hand wash. We put all the respiratory hygiene we already had. If you have a cold, you wear a mask. That keeps stuff from going out. It doesn't keep stuff from coming in as well. We have to make sure that any employees who are working with our seniors are not sick. That's very, very, very important. And we don't mix populations of people who are working, say, in the intensive care unit and then overtime shifts in long-term care facilities. We have to be very mindful of that. Some of these things may seem manini, but we can't afford an outbreak amongst our Kupuna. We'll make the PPE, that's the protective gear, the equipment, for face masks, eye protection, gowns, and gloves immediately available outside of all of our residents' rooms. If you run a facility or you have loved ones in a facility and you don't see it, call me or my staff, or call the Healthcare Association or Department of Health, and we will get it there. It's our responsibility to use these federal funds that were mentioned, and we already have seen some flow. We already received $1.75 million to quickly get a little extra staff. We need much, much more. We have a request right now, we've been adding it up. All of our hospitals have asked for about $44 million of extra gear and equipment in case this goes on for a long time. So those are some of the original updates. I wanted to reassure people that we are spending 24/7 with our hospital teams, with our medical teams, because a lot of things are changing as we go. Right now, as you know, it's difficult to test people because we have a limited number of tests at the Department of Health in all the states, and they're working very hard. But toward the end of this week, or maybe at the beginning of next week, we'll have the private labs able to test. That will expand our testing capacity very, very much. Right now, any lab out there has to go through the State Department of Health, understandably, for people who are most sick. But in the coming days, when our state labs, and that's clinical labs of Hawaii, DLS, and Kaiser's lab, get added to Tripler in the State Department of Health, that is thousands and thousands of extra people that if we have a worry, if we have a granddaughter or grandson that has a cold who must be in to see our Kupuna, we can check them. We can check them to see if they're well. We can check more people who are on the edge rather than in the intensive care unit. So these are some of the very important things I wanted to share. I will add, those who are senior, as you heard before, over 80, much higher risk. So we have to check those individuals early so that we're ready with ventilators and whatnot if, God forbid, they get sicker. In addition to that, you should have supplies of no less than 30 days of your medication. And we will make sure that there are not extra co-pays and so on for seniors and anybody as they get that service. Also, for testing, we will not have any extra fees. We already have a commitment from Blue Cross Blue Shield, from Kaiser, from the CDC has made sure that Medicare will not add extra costs to us, or Medicaid. So we will not get extra costs or receive bills for that testing. And if someone is put into quarantine and anyone receives a bill, just call my team. And we will make sure the hospital does not charge that senior, because that would be inappropriate. We are in the process of finding some other quarantine capacity for visitors. This will not be the concern that we have for our Kupuna, because they either have places to stay at long-term care facilities or in their home. People who can rest at home, even if they have the COVID-19, often will have very mild symptoms, but they'll be at home and safe. If visitors come from afar, We have to find a place where they can be because they shouldn't be at the hotels. And we also have to worry about our homeless moving about if they get sick. So all of these issues basically speak to preparedness. We have our Department of Health working 24/7 on this, our hospitality industry, all of our healthcare providers, and a lot of the private sector to get tests. So all of these things kind of come together, but I know we are worried about the more normal things. How do we get meals to one another? Well, we will once again have to have good protocol, so anyone who is sick, just like anything else, that is going to work. If our workers who are delivering meals have any symptoms of upper respiratory problems, they should then beg off that shift and allow someone else to deliver the meals. If any of our Kupuna or clients are sick, they should not receive the meals directly. They should have someone else receive them so we don't start spreading and bouncing the infection back and forth. But it basically comes back down always to the basics. If you're sick, do not go out, do not be in public places, do not share your germs. If you have to go to work and you feel sick, do not go. Do not go to school, and we'll make sure that all the supplies are available. I think I'll stop there because I want people to once again be reassured that we have very few cases, just 2 in our state. This could ramp up very quickly, and it will certainly change once we test a lot of people statewide. We will likely find some cases that have been lingering underneath the radar, and that will scare people very significantly. But know that the preparation will be the same. We'll still ask people not to be in contact if they're sick, and if there's any doubt, please stay home. We also will be doing other things like setting up mobile centers, we believe, where we can get a quick test for people over time so that you don't have to go sit in the ER. Just call your healthcare provider if you're sick. Don't go sit in the hospital, don't go sit in the doctor's office. We'll recommend how to get you that test. These are the kind of basics that will come into play in each of the next weeks, and hopefully it will do what other coronaviruses have done, which is they burn out come summertime, and the cases drop off very significantly. But we'll monitor it from now till then just to make sure.
Thank you. That was, I'll have to say, very reassuring to me. Thank you so much. What I'd like to ask, make a request of the media is the older folks are watching your TV, they're listening to your radio. Please try to get the information to them, such as you heard today and what will be coming out in the future. This is a tremendous responsibility, but we know that our media people are on top of it. So I think we depend on you. Now for what I'd like to do in the press conference, I think, before I end it, the news this weekend, there are some patients, I think in Seattle, who went from no symptoms to death in a matter of hours. I find this kind of, it has to be corroborated, but I find this particularly scary. We're dealing with real stuff here, folks, and it's going to take a very professional response on the part of everybody, the state, the agencies, the media, everybody, and we can beat this. The media probably has questions, so let's do that now. Please ask your questions, and you'll have the opportunity to interview after the close of the press conference. So anyone who wishes to, if you want to do that, or you can just interview agencies or... Yeah, so if you please identify who you're with and you ask a question. If you could use the mic, it's better.
All right, sorry, I'm also
And
doing it
whoever's going
live.
to answer can come to the podium.
Yeah, and whoever answers, come to the podium, please.
For the media.
So we've been getting a lot of questions about the case yesterday, about what happened in terms of testing, why the gentleman in his 90s went to urgent care and then wasn't tested, even though he exhibited severe symptoms and came from a place that had an outbreak. What happened? What was the gap there? Because he was sent home, and he was essentially out in the community for 4 days before the ambulance came and took him in.
I'm going to speak to what always should happen. Okay, an individual like that should get tested. The challenge has been that the restrictions that were placed on us by the CDC up until last Monday prohibited any testing for any individuals that were not from the countries that were most affected: China, South Korea, Italy, Iran, so on, Japan. So that individual, in my opinion, should have been tested, and that test should be expedited. We can do between 250 and 500 tests per week. We must do that. That's from our public sector testing. In just a few short days, we will be able to use our private labs, which just means that anytime you go to the labs, they can swab the back of your throat and get a strep test. This test is a little bit more invasive, not much more. Requires a swab deep into the sinus, and that test should have been done for that individual. Ultimately, it was done at the hospital. I think that what's happening is there has been a severe rationing of tests because of a concern that we wouldn't be able to test people in intensive care units. My strong recommendation to our Department of Health, who are working very hard, and all providers out there, is to get the test now. We should max out our testing every single day in this brief last window before we have the private sector come on. I've spoken with all of our labs each and every day, including today twice, to make sure that they expedite it immediately so that we can get routine tests for people and that individual would count. I wasn't the clinician at that facility, so I don't know what the circumstance was exactly. Let me speak to providers directly. If someone comes in with a fever and cough, the first thing that we're doing, because this is flu season, is checking for flu, influenza A and B. If someone tests positive for flu, that is basically the end of it. People are not going to get two of these serious viruses at the same time. It's very, very unlikely. If someone tests positive for the flu, they've got the flu, and you can get flu medication, Tamiflu, and go home and rest. If you test negative for flu and someone's still feeling those symptoms, I strongly recommend that we get the test, the COVID-19 test. It takes just 3 to 4 hours here on Oahu, a little longer if you bring them from the neighbor island. Get that test result. As we have more tests, it'll take a little longer, but we still can do same-day testing. And by this time next week, we'll be able to test thousands of people because it'll be in all of our labs.
Do you think it was the misinformation, or not misinformation, but just kind of the lack of information of what criteria was needed by our clinicians on the ground?
It's possible. I will tell you this is what we're doing for our clinicians, and this would be very helpful, I hope. Tomorrow morning, Tuesday morning, and we're going to subsequently continuously do this on Tuesdays, at 7:30 in the morning, we will have a call-in number hosted by the Healthcare Association of Hawaii. We'll post this on our Facebook today about the specifics to call in, where all providers can call in and get the basic information. But let me say it right now. If you have sick individuals that have any contacts for COVID-19 or from an area where we have concern, which is many areas now, including Washington State, New York, parts of California, certainly China, Japan, and Europe. If you come across an individual with these symptoms and they test negative for the flu, please test them for COVID-19, and our Department of Health will press them very hard to make sure they test all of those cases and get the result for us, even if it's just for reassurance. There's another reason to get the test more vibrantly, especially for people in hospital settings, and that is we need to preserve our healthcare community and their capacity to deliver care. So we need to know if people just have the flu, which is no big deal, knock wood, versus COVID-19, which requires a lot more personal protective gear. And that utilization of these resources is necessary because we have to keep the nurses, the doctors, the nurse practitioners, the physician assistants, the aides, we have to keep them clean and well so they can provide the care to the other 1.3 million of us who are going to receive the care. That's very, very important, and why the testing is additionally important.
So when the private labs come on, will the health department, just to clarify, they'll still have to approve?
No. When the private labs come on, it's my understanding they can simply run the test, and those tests will be fully covered. We will communicate all of the test results with the Department of Health so that they see if there are any positive cases and they can follow up. But in the private labs, it will not require a comprehensive approval process, which will mean that we will rely on the advice of physicians, nurse practitioners, and physician assistants to make the order of the test. If people don't merit a test, if they have no symptoms and no risks, it's likely we will not test. But if they have these symptoms or have this risk, they can simply run the test like anything else. If I look at a friend and I'm worried about their cholesterol, I will check for their cholesterol. If I look at another friend and worry that they have COVID-19, I will test for COVID-19.
And then also, are we still going to be looking into doing that surveillance survey 200 sample thing, or?
Yes, that's very important and very wise of the Department of Health. Doing surveillance, although broad testing will also achieve that similar end. but to do surveillance sampling of people who have had flu tests. What that means for people, and I had to learn this myself, is that when you test the underlying tests that have already been done and recheck for COVID-19 from their samples, we can see if there are pockets of COVID-19 that have been eluding us. And the whole country needs to do that so that we can get a better idea if we're also struggling with COVID-19 like other countries that have had a lot of cases, like Italy, like South Korea, like Japan. Japan less so than obviously Korea. And so we'll do that. The Department of Health has to always be very careful about their resources at the beginning of an outbreak. And I know that that's very frustrating for people. And I think that we can do better. There's no question about that. But we are pressing and advising very, very directly that we want to max out the use of all of our 250 plus tests per week, because the people are clamoring for that. And I'm speaking day in and day out with healthcare providers asking me to convey that message, which I will keep doing with our director and his team, who are working quite hard. Yes?
The uninsured, who do they call?
The uninsured will be completely covered by the Department of Health for testing purposes.
Okay.
So they do not need to worry though we have a very small number of uninsured, most people are on Medicaid, but if you are uninsured, the test will be covered by the Department of Health, and you should not be worried that because of poverty, you won't be treated like an equal citizen for the purposes of getting well.
Thank you.
If they do have a problem, we will also be adding these tests to many of the places where we treat uninsured, like some of our little clinics spotted across the state, community health centers, and so on. But once again, it's a challenge for the uninsured or people who don't have a healthcare provider, because they often don't know who to even call, and we're trying to prevent people from going to the emergency room if they're feeling symptoms. If you're feeling symptomatic, call one of the community health centers and we'll direct you where to get a test, or call the hospital or Department of Health and we'll direct you once again how to best approach things. But I will say this, if anyone is feeling short of breath and they've got symptoms, that is the circumstance in which we want you to go to the ER. We will immediately put a mask on a person, divert them so that they are quarantined or separated from spreading it to anyone else.
Thank you.
Hi, Lieutenant Governor Josh Green. Thank you for coming here. By chance, do we know the urgent care facility that 90-year-old man went to first, and is it still open?
My apologies, I don't know the specifics of that, which urgent care facility they went to.
Okay. And then, do you see us stopping, suspending any more flights coming into the island from the mainland, or any cruises are going to be docked here?
Great question. So my personal recommendation has been that cruise ships do a 60-day pause. The cruise ships are enhancing their capacity to screen and check for any individuals that are at risk, but because a lot of people are asymptomatic before they ultimately develop the disease, it's just too difficult. I think the cruise ships are running a terrible risk of damaging both communities where they've been landing and their own business capacity going forward if this continues. Planes will continue to be diminished based on need and volume, and I think that there are some possibilities that the federal government, CDC, and the Pentagon will decide certain other nations that don't have any travel whatsoever, like from China. We may be cresting with the disease in Asia right now, though of course in Europe and here and across the United States, we're just seeing the ramp up right now. So if we see severe numbers of cases from certain parts of America, I would not be surprised if certain airports suspend travel. But I, at this point, think Hawaii is better prepared than any other place that I've seen. We're just mindful because we get so many travelers. So we're going to ask people, if they're sick, do not travel anywhere. Do not travel across state lines. Do not travel across the ocean to Hawaii if you're sick. Wait, postpone your trip, come in a month or two. That's totally okay. Big projects, big events, same thing. If you're sick, don't participate in them. I think some will cancel their operations because they're going to see so few people that are willing to travel, it won't be worth holding the events. We're right on the tipping point of that. We have some of these large events, for instance, the Kona Brew Fest is coming up this coming weekend. They're right now on, but they're asking themselves at what point do they worry? Because there's not been community spread, it's been quite good, but if you are sick, don't go to the Brew Fest. If you're well, go, have a sip of beer, all right? I'm pro beer, but I'm against spreading coronavirus. So we have to make sure that anyone who's sick stays home. This one.
Regarding the cruise ships, what about the one that just travels within the islands? We got a caller today who's upset that Pride of America just put into Kahului this morning. Passengers are out disembarking currently.
I share that person's concern. I think that is I think it's time that we actually pause the cruise ships, and certainly the cruise ships should not allow anyone to disembark from the cruise ships that they have the smallest symptom, cough, fever, shortness of breath. Let me say something general about viruses and spread. People only spread these viruses in a large way when they're symptomatic. When you have high fever, when you really have heavy runny nose or are coughing, that's when you're at the greatest risk to spread. So if someone's feeling 100%, I know you have to take it with a grain of salt, but you are very, very unlikely to catch anything from anyone if they're not actively sick, coughing, runny nose, sneezing on you. But that is not enough consolation to many businesses who are worried. So that's why I think it would be better to postpone cruise ships for 60 days, come back, refund people's money, and then once this is settled down to nothing, have lots of cruise ships come, lots of airplanes flying in here, have our hotels full then. It's better to be safe for our public health purposes. I think really, and I'm meeting with the cruise ship industry on the 11th, which I believe is 2 days from now. I'll be conveying that once again.
Regarding the second patient, we received information about the Hawaiian Airlines flight at about 10:30 last night. DOH indicated that they were waiting for CDC to inform them the airline which flight. Did that information come from the CDC at that time, or did the DOH do some additional investigation on its own to track that information down?
I don't know whether the CDC called them or they called the CDC, but that is about when the information came in. And I think the Department of Health is endeavoring to give people information in real time. When we heard about the first patient, I think it was less than 90 minutes before we held a press conference to share, and we'll continue to do that. Dr. Anderson with his team is very diligent on getting information out. We know it can be scary, but remember, we're not seeing community spread, and we are gearing up all of our healthcare capacity. So I'm not personally worried one bit about whether or not we can deal with an outbreak of COVID-19. I'm much more worried about public confidence that we're not doing enough to prepare. That's why I would like to pause cruise ships, why I would like to get all of our personal protective equipment in place, why I'd like all of our healthcare providers to be able to test before we have any other concerns or variables in the system.
Do you have an update on how many people the DOH has contacted so far? They were indicated at that moment at the press conference yesterday they were in the process of contacting people.
I have to defer to them. I don't know. The question was, who makes the final call on the cruise ship issue? Technically, the federal government and the Coast Guard makes the final call. However, we do have a lot of capacity as states to essentially send a message that we can't tolerate, based on our healthcare system and needs, a large influx of people. And so I think it's very important that we assert ourselves as individual states on these kind of issues. Ultimately, the federal government does have to respond to our states' needs. The cruise ships themselves are very aware that if this continues to go on, there will be no cruise ship industry in the future. And I think that is as damaging to them as our concerns about having a lack of access to tests and healthcare here for us. The interesting thing that came out of the federal government yesterday was the recommendation on cruise ships. They did not do an adequate job recommending, from my perspective, what should be done. They recommended only that people who are senior or who have underlying medical conditions not travel on cruise ships. Now that's good advice for the people to not go on the cruise ships, because they would be at increased risk to get sick and even perhaps to die if they're old. That does nothing for us if a younger person, a 50-year-old like me, were to contract coronavirus, COVID-19, and then spread it to the older people that are in our communities. That's why that's inadequate and why they're going to have to do a better job.
For senior care facilities across the board, are there going to be regulations in place, for every single one, like taking temperatures at the door? So I guess is it going to be like a standard of some kind of precaution across that they all must adhere to, or?
I think it's probably too little time to establish new regulations, but the absolute advice will be to every one of them. And the Healthcare Association is able to convey this advice to all of the institutions that are across the state, to absolutely do what was just explained in the CDC recommendations, which is to post warnings, to not allow any individuals, if they are sick in the facility, to mingle with other patients. If they become sick enough that they need health care, advanced health care, they'll go into isolation and quarantine, that we don't allow sick individuals from outside the community to enter and visit individuals that are at the long-term care facilities, and that we don't have any workers who are sick. These are absolute moral standards, more than regulations even. But over time, this is the kind of thing that we'll probably have to do, because honestly, Infectious disease poses a much greater risk to us than other threats that we've been concerned about over time. It poses a health risk, an economic risk, and a significantly larger risk than we've, say, dealt with as far as terrorism or climate change in the short term. Long term, those issues are gigantic. In the short term, infectious disease are going to affect our people more, and that's why we have to be on top of this.
And then for the people who are at home in home ice quarantine, the 2 patients, and then if there's any others, if they have families or loved ones they live with, what kind of precautions should they be taking, and should they also be home quarantined as well, or?
If people are at home in home quarantine, right now we have between 65 and 70 people in home observation. They do not have any symptoms. They've come from an at-risk area. They don't have to take extra precautions because they're asymptomatic. If people are positive for COVID-19, and we will have more cases of that kind where people test positive and then we ask them to be 14-day home quarantine, we're going to ask them to stay away from their loved ones, at least 6 feet spread. We'll ask them to wear masks at home so that they don't convey any upper respiratory risk. And also, we will have a very low threshold to test their relatives if they develop any symptoms, which will, of course, require them, in turn, if they are positive, to have 14 days at home. If possible, we will ask people to be totally separated from their loved ones in their own private room. And though this is difficult, because a lot of us live in close quarters, in small apartments, condominiums, and have big families, but we'll do our best to do that, to keep people in separate rooms if they're sick.
Sorry, Governor. Are we going to be able to find out that urgent care clinic by chance?
I'm sure we will.
Okay.
We have an 11 o'clock. What we do is 4 days a week, more or less, sometimes 3, sometimes 5. We will have a statewide video teleconference with all of our partners where we'll get extra updates from Department of Health. I have no doubt that the Department of Health will talk specifically to that clinic, find out, and share information as needed. I just don't personally have that information on that individual case. I think that what you can expect is continued transparency, and I think that's what people really want. I just think they probably also want more testing capabilities and a little bit more firm guidance on what our preparedness is. So that's why I wanted to be here today.
I'd like to thank Dr. Green and everyone else for participating. I think you have another event right after. If there are any questions, well, let me say I feel a little better hearing more answers than I had questions today. I feel encouraged, and I hope everybody else is too. And let's bring this conference to a close at this point. Anyone who wants to watch the instant rerun can go to Kokua Council's Facebook page, where the live stream should be available.
Yep.
Thanks to everybody. Thanks
Thank
to all the
you.
participants in our panel.
Thanks for joining our live broadcast. We're going to go off now, and it'll be available play on demand. Okay, thank you much.